Well, my name is Jennifer Veltman. I'm an infectious disease expert here at Loma Linda. Yeah, so that is kind of confusing for many people. The virus is actually called SARS-CoV-2, which is kind of a mouthful. The clinical syndrome is COVID-19, and for all intents and purposes, if you just say COVID-19, I think that's the most understandable way of discussing this virus. There are 7 different coronaviruses, and so if you say the coronavirus, no one will know which one you're talking about. Well, probably everyone will know which one you're talking about, but COVID-19 is probably the best one. So COVID-19 is a new virus that originated in mainland China in early December. It's a respiratory virus that's spread through droplets, which means that when someone coughs, a little droplet of spit or saliva or mucus flies out of the mouth and lands on a surface and is spread from person to person that way. It's a respiratory virus, and it infects primarily the lungs and causes, for some people, just a mild respiratory illness, but for some, a very severe pneumonia. And the symptoms that people usually have are cough and fever. Those are the 2 most common symptoms. They can also have nausea, vomiting, diarrhea, fatigue, muscle aches. These are some other symptoms that people have been describing, but the most common symptoms are cough and fever. Yeah, that's a really, really important question that many great minds are thinking about right now. So the administrators of the faculty medical group are encouraging all of the providers to cancel non-elective procedures, which I 100% support and think is a very important measure that they're putting in place. They're also encouraging for routine patient visits to, when at all possible, convert to video visit and prevent the patient from having to come into the clinic for the in-person visit, which again, I very much support. I also think if there are individuals who are supervisors over other individuals whose physical presence is not required in our institution, I would just highly encourage as much as possible that people work from home as well when that's at all possible. And lastly, if someone is sick, I know as healthcare providers, we always try to take care of others so much more than ourselves. But in this instance, if a healthcare provider is sick, the best way to take care of others is to take care of yourself and stay home if you are ill. Yeah, so my colleague has been seen on social media. There's a number of different home remedies that people are peddling to prevent acquiring COVID-19, like taking garlic tablets, gargling salt water, eating ice cream. I'm not sure how that will work, but there are a number of different home remedies that are being peddled online. And to my knowledge, none of those things have any scientific merit behind them. And so I'd encourage anyone, if they're hearing that there is something you can do to prevent catching COVID-19, to really evaluate the scientific merit of the source that you're getting that from, and to recognize that there's many things posted to social media that have no scientific merit whatsoever. There's also, I think, another myth that's going around saying everyone's going to get it, so why are we all stressed out so much about it? It's here to stay. But the thing that is missing from that perspective is our healthcare capacity is not equipped to handle every American getting COVID-19 at the same time. So yes, it will probably spread in our community and many people will probably get it, but the timing is so critical because we have a limited number of ventilators, hospital beds, isolation rooms, masks, hand sanitizer. These are all pieces of equipment that hospital workers need to keep themselves and other patients safe. And those things are in limited supply right now. So we desperately need to slow the spread of the virus so that the hospitals can handle the individuals that are becoming sick with the virus, and that we don't overwhelm our healthcare capacity. And finally, the last myth is that it's just another flu. But the flu has a death rate reported of about 0.1%, and the coronavirus's death rate is anywhere from 0.6 all the way to 10%, depending on, again, the healthcare capacity to manage the individuals who are ill. So I think our death rate will be directly correlated to how much social distancing we institute right now. Yeah, I hope that this is a season, but like we previously noted, this is a new virus and we don't yet know how it's going to behave. So my hope is that it behaves like the flu, and when the temperatures get warmer, it will fall out of circulation, but we don't know if this will behave the same way. I think that social distancing, you're hearing it on the news all the time, but I think coming from the physician's message has a lot of power. And so even some people in my family are not taking it seriously. They're flying to Florida right now, and they are for vacation, and they're still wanting to go on a cruise ship. So some people are just not understanding the importance of social distancing, and they're also not understanding that it's not always necessarily for themselves, but it's for society and the vulnerable among us that they're doing it, not just for their own sake. So I think physicians really should strongly recommend home isolation, like our governor recommended today. I think our physicians should second that recommendation from our governor for individuals over 65 and those with chronic illnesses. Home isolate until this passes. And I think that it's important for physicians to practice what we preach and also social distance ourselves and not attend large group gatherings. I just canceled my son's birthday party for April, which is really sad, and he cried. But I think that this is the role modeling we need to do. We need to postpone these events until after the virus is at a more stable state.